Hello, everyone. Am I audible?
Yes, you are.
All right. So let's start. Opportunity is not the result of waiting, it's a result of hard work. Good evening to one and all present here, and I thank you so much for putting in the efforts into joining the one of a kind webinar for today, The Pathway to UAE. Representing SSSG, I am Vinola Sutrasu and I will be your host for today. Feel free to introduce yourselves in the chat box to make sure that the session is much more interactive. And for the smooth sailing of this webinar, I kindly request all the attendees to kindly switch off their cameras as well as mute your microphone throughout the webinar. Today, we are fortunate enough to have our special guest speaker, Dr. Afreen Sheikh, who is also known as the White Coat Mama, with us. She is the director of Middle East Next Steps and has bagged amazing feats, such as being the winner of She Awards Dubai. And her actions have clearly exhibited how passionate she has been in helping medical students across the globe to understand and provide guidance through the social media. Thank you so much, Dr. Afreen, for taking your time off to be a part of this webinar. So, during this webinar, Dr. Afreen will be sharing some of her insights and expertise on various aspects of moving and establishing yourself in the United Arab Emirates. And following the presentation, we will also be having a few Q&A session where you can type down any of the questions that you have and that can be asked to her. So with that, let's start with the presentation.
Hello, everyone.
Hello, ma'am.
Thank you for such a warm and lovely introduction. A warm welcome to all the participants. I hope today's webinar will be insightful and helpful for all the IMGs who are watching this. And I hope you will take home some information about UAE exams today. So, yeah, shall we start?
Yes, ma'am, please.
I'm not able to make the screen big. Is there any way I can make the screen big? Yeah, I think now I am. Yeah, yeah. Okay. Yeah, so should we wait for the participants to join or shall I start?
You may start, ma'am. That is fine.
Okay, so welcome to all the participants. I think we have 49 participants here already. So if you are a foreign medical graduate wanting to start your medical career in the United Arab Emirates, you need to know that you have certain exams before you make a start here. So depending upon which pathway you want to take. So today in this webinar, I will try to talk about the major two pathways for international medical graduates in the UAE. Okay, so the major two pathways that an IMG can think of or can take are residency pathway and the general practitioner pathway. Okay, so in the residency pathway, this is nothing but doing your post graduation in UAE. So this is there's an exam called EMRI. EMRI is Emirates Medical Residency Entrance Exam, which, as the name suggests, is an entrance exam for UAE residency, which is nothing but your post graduation. You will be doing your post graduation in UAE. And the next pathway is GP pathway. I'm just briefly telling you about the pathways. I will get into details later on. So the GP pathway, you take this pathway if you're interested to practice as a general practitioner. So this is nothing but after your graduation, that is your undergraduation, your MBBS, with a minimum experience of 2 years, you will be eligible for this particular pathway. That is nothing but general practice, GP pathway. So the next is the eligibility. So what is the eligibility criteria for the residency pathway? For residency, that is who can give residence MRE exam. So there is a set criteria for this particular exam to take this exam. That is final year students, they are eligible for this exam. Those who are in their internship year, they can take this exam, or anybody who do not have a gap of more than 4 to 5 years from their graduation. Okay, so this is a set criteria for to take every exam. But it is always advised to take this exam early as possible, because the health authorities, they usually prefer fresh graduates over old graduates. Just like for USMLE exam, even in the USMLE exam, it's the same thing. They prefer fresh graduates, right? So it's the same even for MRE exam. And whereas for the GP pathway, the eligibility criteria for GP pathway is you have to have your basic undergrad degree, that is your MBBS, or I think it's MD for you guys there in Georgia. So you need to have that plus minimum of 2 years of work experience following your internship. So your internship year is not counted as experience. That's an important point to remember. It's a common misconception. Many of you think even the internship year is counted as experience. No, it's not. Okay, so you need to have minimum 2 years of work experience after your internship. And for those who have graduated from foreign countries that are not their home countries, you have to pass your FMGE exam, which is nothing but foreign medical graduate entrance exam, and have your home country license and registration, work for 2 years post internship to be eligible for GP pathway. So it's basically a long route or long journey for foreign medical graduates who have not done their undergraduation from their home country. So that is the eligibility criteria for MD and GP pathway. So the next question is, what inspired you to share your journey and expertise? So what inspired me was when I was preparing for my exams, I had no one to guide, honestly. So, and I'm sure that's the same case for all of many of you also. Google has always been full of misinformation. So taking information from Google is a waste of time, honestly. So, and there were during my time there were many fake websites that were selling outdated or wrong materials. There were scammers everywhere waiting to loot me, and unauthorized study files as well. So that's why I thought wasting it was basically a waste of time. I wasted many months over this, finding the best, I was obsessing over the best resource. Which is the best resource? I wanted to get my hands on it, but I think that was just waste of time. So I had a tough time initially. So then I decided I will not look for shortcuts or follow the crowd who was also clueless like I was. So one day I finally sat down and I decided, no matter how long it takes, and I will start my preparation from scratch. So let me tell you, I had a gap of I think around 1.5 years to 2 years in my work experience when I came to UAE from India. So I had a gap in my clinical experience. I was not working for that long, so I could not afford any shortcuts. I didn't want to just read any shortcut materials and pass the exams, because I wanted to make sure I will be a good clinician at the end of the day, even after I pass my exam. So that's why I decided to start preparing really well from the standard books that everybody reads for GP exams, which is MTB, which is also my favorite book. I totally vouch for this book. This is MTB Step to CK by Conrad Fisher. This is the standard book you have to read for even for your residency, or be it your residency exam, your GP exam, or any other exam, licensing exam for Gulf country. So this is your go-to book. And trust me, it is the best book you can choose for these exams. Along with that, I studied from Telegram channels as well. There are many free open channels which you can join. You can join study groups. You can also take reliable subscriptions. So you can do these things. And this is what I did during my time. And the reason why I started IG page was to channelize my journey, my hardships that I faced during my prep days, which later on got recognition. And I thought I should put this platform to good use to help others with whatever little knowledge I had of these exams and guide the IMGs. So, yeah, here we are. So, that was my white coat mama page journey. So, the next question is What regarding your path, what would you have done differently? I wish I had a mentor who was there to guide me. So that is really a blessing if you have someone to guide you, honestly, because then probably maybe during my time I would not have had to do this long exercise during my days. The kind of mentor that I never had, I aspire to become one day for IMGs like you guys. So, who wants to come to UAE to settle down, or any other Gulf countries for that matter, and have a dream to practice medicine here? So, yeah, and another thing is, I wish I had not wasted my time, like I already said. I wish I had not wasted my time obsessing over perfect resources for my exams. And also, I wish I had started a little early. But I think it's fine. Everything happens for a good reason, and Alhamdulillah has a great end to every story, and this is mine. So, yeah. Can I see the questions? Like, I think the page is gone.
Yeah, just a moment, ma'am. Sorry for that. There has been a technical issue. She'll get back with the presentation. Vinola, if you can go forth with. Yeah, we already have it, so yes.
Yeah, the difficulties. What difficulties did you face in your DHA licensing exams? So I think I already spoke about it. It's the same thing. I got my hands on the wrong materials and I subscribed to a fake website. So I think I wish I had not done that. So one advice I would like to give you all, to all the aspiring candidates who are planning to right, licensing exams, not the residency, licensing exams. So there are n number of websites on Google. If you start looking for it, there are many websites. So please check for the authenticity of the websites before you enroll or subscribe. So this is very important. And also there are many scam, fake, fraud pages on Facebook and all everywhere on social media. So please don't waste your money. Don't put your money into something that will not give you any help. So just these are things that I want to tell you from my experience. So yeah, think we'll go to the next page. MRE exams, yeah. So this is the first pathway that I was talking about. This is the residency pathway. So about MRE, study materials, preparation time, and number of attempts. EMRE, like I said, it stands for Emirates Medical Residency Entrance Exam. As the name suggests, it's an entrance exam to get into the residency or the PG programs in the UAE. Okay, like every other entrance exam, even EMRE is relatively a difficult exam, but with a good and strategic preparation, you will definitely pass with a good score. Not just you should not aim for a passing score, but a good score. Okay, so you asked me about study materials. The primary resource, what I would suggest is read past papers, because what happens is vast majority of the times it is set that the papers are usually repeated. At least 30 to 40% of the questions are usually taken from past papers. So it's very important to know your subjects and read your past papers, MG recalls, and understand the syllabus. This is also very important. You need to know what to read, because you cannot just keep reading what is not required. You know, there are certain high yield topics that are given. It's there even on the official web pages of these health authorities, so you can take a look at those. So know your syllabus, understand and become familiar with the type or pattern of questions they normally ask. So it's mainly clinical scenario based MCQs. Okay, so it's a 3 hour long paper with 120 clinical scenario based MCQs with 4 options, closed options to choose from. So, and there are no negative markings. The questions are generally majorly asked from clinical subjects, major clinical subjects like internal medicine, surgery, pediatrics, OB/GYN, and of course from minor subjects as well, dermat, ENT, ophthalm, psychiatry, epidemiology, etc. So these are the things. And the books that I would recommend for EMRI and which are generally preferred also are First Aid USMLE Step 2 CK, and or Master the Boards by Conrad Fisher. Or you could read Oxford Handbook of Clinical Medicine, PLAB notes, anything, Toronto notes, your medical school clinical notes, even that helps. If you're a final year student, even those clinical notes also will help. You don't necessarily have to read all of them. Just stick to one standard book and read past papers. Keep practicing MCQs, subject wise MCQs, and anything you're comfortable with, because it may work for one and may not work for the other. So just stick to one standard book of clinical medicine, or anything that has all the clinical subjects in it. And additionally, um, on the exam, they basically test your clinical knowledge, and the questions asked are often long clinical scenarios. So it's very essential to understand the concepts to be able to answer any question that's asked. So have a concept based learning. This is what I tell everyone. Understand the concepts, what they're trying to ask you. Because, see, if you read the past papers, in one question, they would have asked you what is the most appropriate investigation, but on your paper, on the final exam paper, they can ask you the same question, but they'll ask you about treatment. So for you to understand, you need to understand the concept and read everything about it, not just cram or mug it up. Just mug up what is asked on the past paper. Just understand the topic and then read everything about it, from the diagnosis, investigation, management, and everything about it. So that is how I think you should approach every question. Even it's the same for GP exams as well. So, and the second question what you asked was the third question, number of attempts. So yeah, the pass percentage is 55%. But if you're aiming to do a residency in one of the major clinical branches, major clinical subjects, then you should aim for at least 80 to 85% score on MRE. Okay, so you should not aim for a pass percentage, you should aim for higher. At least 80 to 85 for a core specialty. Core specialties like those major branches, surgical branches, internal medicine, and radiology, and all of those things. One thing to note here, this is an important point. You cannot reattempt for next 1 or 2 years if you have passed MRE with a low score. Suppose you have scored 55, just a pass percentage, or 56 for that matter. So then in that case, you will neither get a PG seat, nor can you attempt for another 2 years. So you have to strategically plan and give your best shot at the first attempt. Okay, you can reattempt MRE up to around 4 times a year if you have not passed. If you have got 53 or 54% in your first attempt, you can attempt for up to 3 years the same year. Because your exam annually every year, the exam starts from December to March. Suppose you have taken your first attempt in December and you have not made it, you can still appear for 3 more times till March. So you have that thing. It's open for you. But one thing to remember: the higher the retakes, the lower are the chances for your application to get accepted. So that's another problem there. So that is why it's always better and best to give your the best at your first shot. There's no point in giving retakes, because if you're giving a retake, then your application may not get considered, because it will be a bad remark on your transcript, or in if everything gets noted, and the health authorities will take a look at how many attempts you have given, and they may not consider your application. So resources for MRE, I've already mentioned that. I've already told you. Overview of different licensing exams. So this is, again, we are coming to the GP pathway. Licensing exams are nothing but you give a licensing exam if you're considering a GP or a specialist pathway. Okay, GP is for post MBBS doctors and with a minimum experience of 2 years, and specialist is for post MD or MS, post graduation. Those doctors fall under the category of specialist. They need to have a minimum of 3 years experience. So overview, UAE basically has 7 emirates, as I think you all know about it. And there are three major licensing exams, okay, that are categorically divided for these 7 emirates. 7 emirates, or you could call them states. So for for Dubai, you have DHA exam, which is nothing but Dubai Health Authority. For Abu Dhabi and Alain, you have DOH. Okay, So, and for the rest of the Emirates, which is a DOH or HAD, it's also called HAD. I think HAD is a more familiar term for most of the doctors. Um, DOH is nothing but Department of Health. It's also called HAD. For the rest of the Emirates, which are Sharjah, Fujairah, Ras Al Khaimah, and Ajman and Umal Quaim, you have MOH, Ministry of Health. So um, you have to pre-decide which emirate you want to work in and then apply under that particular health authority. You cannot. It's a common misconception that everybody thinks DHA is the only exam for the whole of UAE and Dubai is the only emirate. Only Dubai is UAE. That's the common misconception, which is a misconception. There are many other states as well, which we call here emirates. So yeah, there are different exams for different emirates. So you have to pre-decide which emirate you want to get into. The pass percentage for licensing exams for GP is 60%. But again, you should aim for at least 65 so that you can at least reach the pass percentage. You don't have a scoring system here. It's either pass or fail. And there is no major significance if you get a higher percentage or anything. Okay, it's unlike MD exam. So that is about your passing percentage. So the cutoff marks, number of questions, types of questions, duration of the exam. So you will have 150 clinical scenario based MCQs with 4 options to choose from. Again, it's a clinical based questions, just like your MRE, USMLE, and all the other licensing exams that you know of. It's the same. But the duration here is 3 hours, 150 MCQs. And for specialists, the cutoff is 65%. Specialist exam pass percentage is 65%. For GPs, it is 60. And yeah, duration of the exam is 3 hours. Is proficiency in the Arabic language a requirement for an internship? So no, it's not a mandatory criteria. It's not a requirement, but it's always an added advantage if you know Arabic, if you're coming to a Gulf country, Arab country. Okay, and the cost of the internship is, I think, $1,000. $1,000, I believe. I'm not very sure of the figure, but most probably it is $1,000. Yeah. So, and yeah, can we go to the next slide, please? Yeah. Yeah, I think I forgot to mention about you asked a little more about the medical internships. I want to tell you because I just want to put 2 more sentences here, add 2 more sentences here instead of just telling you about the cost and just leave it there. So the graduates from internationally recognized colleges from different nationalities are accepted for registration, and that's another misconception that a lot of doctors think that they from a particular nationality is they are not allowed for medical internships here. That's another misconception. They are allowed as long as it is their university is internationally recognized. And another criteria is that they should not exceed 2 years from the date of passing their graduation. They should not have a clinical gap of more than 2 years. So these are the candidates that are uh, welcome for internship in UAE. And I think the training dates for internship this year are from August. They have not opened the links, I believe. So for medical internship is from August, and for dental internship it is from September 2024. So yeah. And the next question is, what is it like to be a doctor in UAE? Yeah, UAE is a great place to settle down. So it has a very high quality of life, great work-life balance, no toxic culture, unlike some of our home countries. You have fixed work hours, even if you're a resident. So even if you're a resident, you will get a very good, I mean, a good decent stipend of around 10K dirhams per month for a reasonably decent work. That and they don't slog like the postgraduates back in our home country. They have a very good decent work hours, and they work like registrars. They don't slog like postgraduates. Yeah, and you get annual leaves every year, additional benefits if you're a specialist. And there is one more important addition additional thing that I want to tell here is that UAE government has started a great initiative. I've made a video on that as well. It's a wonderful initiative for healthcare workers. That is a golden visa. I get a lot of questions on golden visa, so I wanted to add this point as well. So golden visa is nothing but the UAE government has introduced this for doctors and even for some nurses. But yeah, there is a specific criteria for this with a salary cap. Okay, there is a salary capping for this. It's nothing but you get a 10-year visa for you yourself, if you're a doctor, and you can sponsor your family. Okay, you can sponsor your family, you can sponsor your housemaid, and I think there is a number, the specific number to how many people you can sponsor. Apart from that, you can set up your own medical clinic and a lot of other benefits. You will get a 10-year long visa. So Alhamdulillah, I have been given golden visa along with my family, Alhamdulillah. And I'm really thankful to the UAE government for that. So with golden visa, you can plan your life for the next 10 years in this country. So I think that's a great thing. Otherwise, here you get a residence visa for just 3 years and you have to keep renewing it. For doctors, this is a big advantage and a big boon, I would say, blessing. So yeah, but like I said, it's only given under certain specific criteria with the salary capping. Okay, so yeah, so all in all, it's the best country to live in, and the salary package depends upon your category, whether you're a specialist or a GP. Specialists definitely get a higher salary based on their specialty again. So based on their specialty, they get their own benefits and stuff. And for GPs, it depends on your portfolio, your how strong your CV is, any extra degrees like diplomas or fellowships that you have done, and the number of work experience and any additional academic qualifications if you have. So if you have all these things put on your digital portfolio, which is your CV, you can negotiate based on these things, and ask for a better package. And but for freshers, you will have a basic salary. And as you know, UAE has a um, UA is really saturated at the moment, but it does not mean that there are no jobs. There are jobs, but the doctors applying for those jobs are more. So that is what is happening. For suppose, for example, if there are 10 clinics or 10 hospitals, there are 50 doctors applying for it. So they will choose the 50 best doctors. So for the doctors to be really for them to really stand out, you have to work on these things. Work on your CV, work on adding additional degrees and all of these things. So yeah. Next slide, please. After graduation, if we do an internship in a different country for 2 years, does that count as work experience to work as a GP in the UAE? Internship is not counted as experience, period. It's not counted as experience. It's a mandatory criteria for both the pathways, which is your residency pathway as well as your GP pathway. It's a mandatory requirement, a minimum 2 years of work experience, minimum. Sometimes they will not even consider 2 years, they will ask you for a 3 year or a 4 year. So it has happened with many doctors. So they straight away ask, it depends on their mood. So it keeps changing on the health authority, the official website. So it's a mandatory requirement and they're very specific about it in both the pathways. Internship is a mandatory criteria. Yeah. I think with this, we've finished this presentation.
Yes, of course. Once again, thank you so much, Dr. Afreen. Like that was so informative, and that's it's obvious that there's so much more to consider when we are planning to move to UAE. And thank you for providing all this information in such a simplified way. So before we move on to the Q&A session, we would like to make a small announcement. And our executive coordinator Niyati, would you like to make the announcement?
Hello, everyone. I hope you all are doing good. Thank you for joining in. Thank you very much to Dr. Afreen herself for this wonderful session. Stay tuned even now because we are going to have a very engaging Q&A session with the doctor, so you will get to know more, and she will also be able to answer more questions. And yeah, that is about it. Dr. Afreen, are we planning somebody from your team to talk right now, or they can talk
No,
later?
towards the end. That'll be towards
All
the
right.
end. I will
All
I
right.
will
Yes. No
introduce them.
problem. No problem. So in that case, I think we can go on with the Q&A session now. Pinola.
All
Yeah,
right.
definitely. Yeah.
All right. So before we move on, I'll just start with the questions. So first question is, can we practice in the USA or UK after completing residency from UAE?
You mean the after residency from UAE, right? Yeah.
Yes.
See, you this MRE program is slightly, it's relatively newly introduced in the UAE, so it is not internationally recognized as of yet. So if you're planning to move to UK or UAE after completing your residency here, you will still have to give your USMLE and PLAB exams. But I know for sure is that what I know for sure is that this particular program is recognized in Canada. Yeah. Apart from this, I'm not very sure as of now, but I'm sure in the near future it will be.
Oh, all right. The next question is, can a final year student give EMREE in advance?
Yes, you can take this exam if you're a medical, if your medical university is listed under WHO, the World Health Organization directory. In fact, the eligibility criteria are those who are in their house job, internship year, anybody who are in their final years and who are in their internship year, sorry, I'm sorry, and anybody who doesn't have a gap of more than 5 years from their graduation. So this is the criteria for eligibility criteria to give MD exam. And you have to make sure that your medical school or the university is listed under WHO directory. But to apply, there's a catch here. But to apply for the residency programs, especially for the final year students, you have to complete graduation and a mandatory internship period. So only after that you can start applying for residency programs, even if you have passed your MRE. Yeah.
Oh, okay.
So
Uh,
the yeah, and one more thing is that the third criteria that I told you, anybody who doesn't have a gap of more than 5 years from their graduation, I would suggest taking this exam as early as possible, soon after you finish your graduation, rather than just waiting for that long. Because, like I said earlier, the health authorities prefer fresh graduates. Yeah.
all right. Okay, okay. So the next question is, do we need to do an internship a year after finishing our 6 years to be eligible to write the exam?
Which exam?
The EMREE exam.
MRE. Yes, yes. I told you, internship is a mandatory criteria for both the pathways, be it MRE or GP pathway. It's a mandatory criteria. Yes.
Oh, all right. The next question is FMGE essential to practice in UAE? And how to join as a GP in UAE after clearing FMGE?
After FMGE, yes, FMG is a mandatory criteria if you don't have your home country registration. It's not a mandatory criteria for those who have done their MBBS from their home country. So it's only mandatory if you don't have your home country registration. So clearing FMG enables you to apply for your license in your home country, which is absolutely essential during your data flow verification of your documents. Okay, this is for the GP pathway. Since you asked me for the GP pathway, and after FMG, if you have completed 2 years of work experience and internship plus 2 years of work experience, minimum experience, you will be eligible for GP pathway. And yeah, the licensing exams I told you are categorically divided into for 7 Emirates that are DHA, DOH, and MOH. You will first have to choose which emirate you want to work in, then apply for it accordingly on their official websites. That is DHA for Dubai, DOH for Abu Dhabi and Alain, and MOH for the rest of the Emirates. Then you have to start the process. But I would advise you to start your exam preparations simultaneously. Then you will have, following that, you will have something called data flow verification, where they will verify all your certificates, degree certificates, experience letters, good standing certificate, your FMG, and all of those things. So, and internship certificate as well. So, this is a process that takes about 3 weeks to 2 months' time. So you can simultaneously start your study preparation during this time. And once your data flow comes positive, you're good to book your exam after a good preparation. So do not wait till your data flow comes for you to start preparing. You need to start preparing the day you start your registration. Okay, so and once you clear your GP exams, you'll get an eligibility letter. With this letter, you can start looking for job positions. So yeah.
Okay, that was very clear. And the next question is, does clearing AMC exempt us from writing the MLE in UAE, like how USMLE and PLAB does?
AMC, yes, AMC and GMC registered, and those who have passed all the steps of USMLE, the New Zealand exam, New Zealand NZREX, EMRI, and Canada LMCC. It's a Canadian licensing exam. So these are some of the exams that gives you exemption for GP exams. Only GP exams, not the residency exam. So if you are registered in these countries, or if you have passed, or if you have passing certificate from these countries, you will be exempted from GP exams only. But the exemption criteria does not apply for work experience. It's only for the GP exams. And one more additional point I want to add here is, if you have completed your steps, all the steps of USMLE, it's only wise to do your US residency and then come to UAE instead of getting into GP pathway here, because the perks you will experience as a board certified doctor in UAE is huge. It's enormous. So you will get to work as a tier 1 consultant after required number of work experience. So as some of you know that I've recently partnered with a USMLE educational preparation platform, which is called Next Steps. It's a premier USMLE educational platform. One of my team members, Dr. Gautam, who is a pulmonologist, is also here with us. Um, Dr. Gautam, are you
Hi.
here?
Yeah. Hi.
Yeah. So he will be talking a little on USMLE in brief. So yeah. So he will give
Yeah.
you insights about USMLE in brief. Yeah. Over to you, Dr. Gautam.
Yeah. Thank you. Thank you so much, Dr. Afreen, and also to all the students who have attended the meet and the host. Like especially, I'm really thankful to the host for giving us this opportunity. And today, till now, we all have heard about the UAE pathways, and I just want to add few insights about the USMLE and how USMLE can be connected to the UAE pathway. So each and every student, like most of the students that we encounter are from different countries. Some of you are from many of are from Philippines, Georgia, Russia, Uzbekistan, FMGs. So the common problem they do face is they need to take the FMG exam if they want to get the permanent registration. They have to go to the home country and get the permanent registration. But the thing is, if they follow a route called, which we call it as pathway 3, and from that they can enter into the USA for the clinical residency without getting any permanent residency. I mean, permanent registration from their home country. They can get directly from their home country to the to doing the residency in the US, which is a period of like 3 years, and then they can come back to the UAE, where in UAE they directly get a post of the tier 1 consultant, which are the highest paid. So the whole point here is, many people, they can directly go to the from Georgia, they can go to the UAE by going through the exams. And if there is any difficulty in the pathway or anything, they can follow another route, which is the USMLE route. And this USMLE, so many people might have many misconceptions about USMLE. So I'll just give it a brief. Like in the USMLE, there are two exams, that is USMLE Step 1 and Step 2 CK. These are the written examinations, and these can be taken after second year of the medical school. And once the students are done with the two steps, we are going to place the students for 3 months of internship, and then they are going to get the ECFMG certification with the two steps and this three LRs. The thing is, after doing 3 months of internship in US, they get 3 letters. With that, they apply for the interviews, and they get to select for 3 years of residency. Okay, so this is a pathway where many students have a lot of misconceptions. So today, like if there are any questions from the students end, I would like to answer few concerns. Like if they post anything regarding USMLE, I would like to answer them. So do we get any kind of questions on that regarding the USMLE?
As of now, the primary questions have been revolving UAE exams, and
Okay.
of course, if there's any other questions in the chat box, I will be
Mhm.
informing you.
Sure. Thank you so much. So for the students, like they can think of a pathway for getting directly into the UAE. There is a pathway they can come through the USMLE too, going there and directly becoming as a consultant in the UAE. So I hope like you guys got a brief insight about like the pathway and all regarding the USMLE.
Yes, we did. Thank you so much for that, Dr.
Thank you,
Gautam.
Dr. Gautam. Yeah.
Thank you.
So now I'll be asking you some questions from the chat box. So the first question is, after Emory residency, can I be able to work there, and will I get a license without DHA or HAD?
Of course, yes, you don't have to give DHA again if you have passed your residency here. You will be initially working as a registrar, then promoted to a specialist, and then after I think 3 to 5 years of experience, you will be working as a consultant in the UA. You don't have to give any other licensing exams.
All right. So my next question is, do we get paid for the internship?
Yes, around 10K AED
Oh,
per
all right.
month.
Okay. And could you also tell how many seats are available for PG after the Emory?
That depends on the availability. It is first come, first serve. We cannot tell that for sure. You will have to check it on the website. It keeps changing every year.
All right. So can you also tell us when we have to do the Emory and the licensing exam in relation to the 2 years internship, and how would it go by step by step?
You guys have 2 years internship after your graduation, or is it 1 year?
Here specifically, it is 1 year, but I believe in some countries it is also stated as 2 years.
Okay, so what the requirement for residency pathway and for the GP pathway is at least 1 year, the 12-month mandatory period, and 2 years of work experience following that. So for the 2 year internship candidates, you will have to check it with your university on what works best for you. Yeah, but the requirement is 1 year plus 2 years work experience for the GP pathway, and for the residency, it is 1 year internship. No experience is needed. Yeah, for those, I think you can give your exam in the final year because you're still fresh with the clinical knowledge. So you can give your exam or at least start preparing for your exams from your final year. And when you're in your internship period, you can give your MRE exam. Yeah. Then once you finish, you can apply for residency programs here.
All right. The next question is, what are the most in-demand specialties in UAE as of 2023-2024?
The surgical branches, here the duration is around 4 to 5 years, depending upon the specialty. Here, you can do your residency even in the super specialty directly. You can get matched even if you have a really good score, you can get matched into super specialty branches as well. So yeah, it depends on your score entirely. Scores as well as, and there are many other factors. The four major criteria I will just quickly walk you through. It is your MRE score majorly, the score of 80 or 85. Try to score above if you want to get into really premium branches. So it's considered a good score to get into core specialties, and CV. Even that's a major criteria, a professional CV. This should include everything related to your academic and extracurricular activities, because if you only have your academic qualifications mentioned on your CV, then the program directors may not consider taking your application forward. So make sure you have a right balance, a good balance of both academic as well as extracurricular activities on your CV. You can add things like ACLS, you can do ACLS, BLS, mention if you're good in communication skills, mention about that, your leadership qualities, volunteer any events if you're volunteered, academic awards if any, and if you have any research publications to your name. So these are the things that will make your CV stand out apart from your MRE scores. And you will also have to do your English proficiency exam. It's a mandatory criteria. So not this is another question that I keep getting. It's not mandatory to do this to have this certificate English language exam certificate before MRI. You can do it anytime before you're applying for your residency programs. So you can do it after your MRI exam as well. So that is about your CV, and your academic scores also play a great role. Your GPA score should be at least 2.5, and if your university does not have a GPA system, scoring system, the percentage should be at least 75 on your transcript. And the last one is, once you have cleared your MRE, I'll just tell you what is the pathway or what is the procedure after that. Suppose you have cleared with a good score. So you will be shortlisted for MMIs. MMI is nothing but multiple mini interviews. Okay, so based on which health authority you choose, whether it is MBRU, which is Mohammed bin Rashid University for Dubai, or DOH for Abu Dhabi, or EHS for Sharjah or rest of the Emirates. So which health authority you choose, that is an online portal through which you have to apply for residency programs. So based on that, they will shortlist you for these short multiple general interviews. And if you clear those interviews, it's many multiple interviews. So if you clear all of them, they will again shortlist you for the specialty interviews. So this is specialty interviews, nothing but you will be giving interviews under the specialty which you choose for your residency program. Suppose you choose for internal medicine, you will be shortlisted for internal medicine specialty interview. So that will be conducted by the specialty consultants or the program directors. You will be asked questions on that particular specialty. So yeah, this is how it goes. And it's not just the MRI scores. You have to take a look at these things before you think about residency in the UAE also. Yeah.
All right. The next question is there any specific website for self assessment before writing MRE?
Before writing MRE, you don't have a self-assessment. You have, I have linked it on my page. I can send it to you later. You can put it on your group. It's NIHS, NIHS, National Institute of Health Sciences. There are 2, 3 others. You can check for the information. If you're looking for information, you can check on this website. But for GP pathway, you will have to do a initial self-assessment, which will tell you whether you're eligible for the chosen category or not, whether be it GP or a specialist. So it will tell you whether you're eligible with the experience that you have, whether you're eligible to work in the UAE or not. So this particular online assessment, initial assessment, is for the GP pathway, which is available on, again, the official websites. Yeah, you just put in your credentials and all the documents or certificates that they have asked you, and they will tell you whether you're eligible or not.
All right. The next question is how to choose the states, whether it's Abu Dhabi or Dubai or any other Emirates.
Choose as in it's you choose where you want to go, right? So some people like to go to Dubai, so they choose DHA. DHA is the exam for Dubai, like I said. And if you are choosing Abu Dhabi to work or to live, or if you have a family in Abu Dhabi, you go to Abu Dhabi. For that, you have to go through DOH, which is Department of Health. That is the exam. And there are specific different websites for different Emirates. MOH, there are 5 Emirates that come under MOH, which is Ministry of Health: Sharjah, Fujairah, Ajman, Ras Al Khaimah, and Al Quwain. And under DOH, there are 2 Emirates, Alain and Abu Dhabi. So if you're planning to settle down in one of these Emirates, there is a different particular exam for these Emirates. So that's how you choose.
Okay. The next question is what is the process to go through once we clear MRE? Like how to find a job in any hospital?
MRE is for residency pathway, right? So it's not to work here. DHA or HAT or MOH is to work here. So MRE is a residency pathway. MRE is just an exam. It's not, it will not directly straight away give you a residency program. So post MRE, you will have to, I told you just 5 minutes ago, after MRE exam, you will have to apply for the residency program through different Emirate online portals. For Dubai, it is MBRU. For Abu Dhabi, it is DOH. And for the rest of the Emirates, for residency pathway, it is EHS. Okay, so once you get into the residency program, you start working as a resident. You don't work as, you will be a resident. Resident is nothing but a postgraduate. So you are not working, you are getting into a residency postgraduate pathway after MRI. Whereas for GP pathway, you will be working as a general practitioner. Okay, so once you pass the exam, you will for the GP pathway. Once you pass your DHA, whether it is DHA or DOH or MOH, depending upon which emirate you choose, you will have to do your data flow, write your exam. Once you clear your exam, you will be given an eligibility letter with which you will go looking for job positions. So these are two different pathways. One is residency pathway where you don't work, you will be a postgraduate. It is a training program. Whereas GP pathway is for you to work. It's a licensing exam.
Okay, understood. So the next question is, what is the ideal structure for a CV regarding UAE?
For CV
The
for the
MBA.
residency pathway or which one?
To both, if possible.
Yeah, I have already talked about it. I told you what are the things that are needed to be put on the CV. Just include your all your academic qualifications, whatever you can. This is for the residency. I'm saying, just may have a good strong CV. You know, it's the same for both actually. For GP pathway, see the only additional thing will be your work experience, which you will not have for the residency pathway because you would not have worked, right? You will not have any work experience if you are planning to do your residency. You will not have that much of a work experience. So whereas for the GP pathway, you can add your work experience wherever you have worked and your expertise, and if there are any standout features or anything from any academic qualifications, any awards that you have received, you have to mention all of these things. Apart from the academic aspect or the qualifications, you can even mention the extracurricular stuff that you're good at, communication skills, leadership qualities, or yeah, any research work that you have done, any research publications that you have to your name. So these are the things, you know. And one advice I would give is, if you're planning to anybody, not you or anybody, just in general, for the GP pathway, I would suggest, just if you're coming as a fresher with just MBBS degree, you may not find a position easily because of the saturation that's going on. So, like I said, there are many GPs waiting for limited number of positions. So try to add in degrees, like at least fellowships or diplomas or things like that, and make sure you have done your ACLS or BLS certification or PALS or something, so that just it stands out compared to the others. So yeah, it's the same even for the residency, except that you will not have a work experience. You will not have work experience. So yeah, apart from that, you can add any other extracurricular or academic qualifications.
All right. The next question is, what are all the materials anyone should use while preparing for UAE MRI exam?
Yeah, this, like I already mentioned, the questions are generally majorly asked from clinical major subjects like surgery, internal medicine, and OB-GYN, pediatrics, etc. So you need to just read one good standard book that has all these clinical subjects in one place, okay, and have a concept-based learning. So the books that I normally recommend is First Aid, USMLE, Step to CK, and Master the Boards, Step to CK by Conrad Fisher. This is the go-to book. You can read this because this has all the subjects in one under one roof, in one book. So just read this. And Oxford book is also a good book. Oxford book of clinical medicine, and Plab Notes. Lab Notes is also very good. It's concise, and all the high yield topics are given in one place. Or Toronto Files. This is another, a lot of MD aspirants read Toronto Files. So this is for the Canadian board. They usually prefer this textbook. It's a textbook. So you can read that. Or even if you're like I said, final year medical student, you will be fresh with the clinical knowledge. So you can even read your medical school clinical notes, what you have written yourself. Okay, so even that will help. And just stick to something that you're comfortable with. I keep saying there's just one resource or two resources. You don't keep reading. You don't have to feel missed out if I'm not reading 10 books or 5 books like the others. Will I pass or not? Don't be stressed out over that. Just one or two good standard books that has everything in it. And read past papers, MCQ. Just keep solving MCQs, which is subject wise. Keep solving MCQs so that you'll get an idea and you will be more familiar with the type of the nature of questions you will get in your exam. Yeah.
Okay. The next question is, after finishing residency in UAE, do we need to apply for jobs again or is it directly given?
You don't have to apply for jobs because you will have a you will have you can work in the same hospital where you have done your residency, so you don't have to worry about jobs here if you have done your residency here. Yeah, because the preference is first given for the primary graduates or the residents who have completed their residency from the country, right, other than those who are coming from outside. So the first preference is given to those who have done their residency here.
Oh, okay. And the next question is, how can we apply for residency in UAE after 2 years internship in Qatar after giving the USMLE steps? And in this way, do we need FMGE?
Sorry, can you repeat the question?
Yeah. So how can we apply for residency in UAE after 2 years internship in Qatar
Okay.
and after giving the USMLE steps? And do we need the FMG in this case?
Okay, where is the graduation done from? Which country? Is it, does this doctor have the home country license or registration?
I'm not really sure. It's just
Okay.
yeah.
Okay, so if this doctor is looking for a residency pathway, USMLE will not give any exemption to the MD exam. In fact, there is no exemption to MD exam. You know, even if you have done PLAB, even if you are GMC or AMC registered, even if you have cleared all the steps of USMLE, there is no exemption to MD exam because this is an entry exam for residency in UAE. Just like if you're planning for a residency in US, you cannot use the MRE scores there to get into residency, right? So likewise, so you have to give your MRE exam in if you want to start your residency here, even if it's after 2 years of internship or 1 year. You will have to give MRE exam. That's a mandatory criteria.
All right. So with that, a lot of questions regarding the MD exam has been asked, and there are a few questions regarding the USMLE pathway. Dr. Gautam, would you be willing to answer that? Dr. Gautam, am I audible?
Yeah.
All right. So the first question regarding the USMLE pathway is, what residency pathway in the US is there for 3 years, as you've mentioned? Could you brief on that?
Yeah, so there are total of 6 pathways. So I'll keep the discussion very short so that it won't be confusing to the new students. So there is a certification like students who give step 1 and step 2 CK, and then they need to get an ECFMG certification. And for that, getting that certification, it's like a licensing certification, a basic examination. What is it? The certificate which gives you the credibility that you have cleared the steps and all. For that certificate, students would be going in different pathways like pathway 1, 2, 3, 4, 5. So many colleges were recognized by us what is it, the US board, where they can enter through the pathway 3. So they don't need to go back to India. Most of the students who are from India, they don't need to go back and give their FMG exam, which is very difficult exam, almost like the pass rate is almost like 10%. They don't need to go back, and they just can apply through the pathway 3 and they can get that FMG certification. So in this way they can exempt that FMG exam and also the internship that they need to do once they come back to India. So these are the two advantages the students were getting through that pathway 3. So if they want to go through the pathway 1, they have to go to the home country, they need to give their FMG exam and they need to do the internship, then get the permanent residency, and then they have to apply through pathway 1, which is bit tiresome process. So pathway 3 is bit easier and more convenient for many students. So they can just, if students, many students, I'm assuming that many students are from Georgia today. Am I right?
Yes,
Yeah.
that's right.
But this video will reach a lot of other students as well, so
Yeah.
you can
Okay.
just give a general
Okay.
answer.
Sure. So the thing is, for USMLE, they need to take two examinations, step one and step two CK, and get the ECFMG certification, and then go for 3 months of rotations, apply for the interviews. So these are the basic steps, two basic steps for the USMLE. Yeah, I hope I answered that question.
Yes, doctor. The other question is, can you please explain more on USMLE Step 1?
Yeah. So the step one basically consists of subjects related to first year and the second year medical school. There is anatomy, physiology, biochemistry, pathology, microbiology, and pharmacology. So these are the basic subjects involved in the USMLE step one. And the step two CK consists of mostly of final year med school syllabus, that is internal medicine, pediatrics, gynops, and general surgery. So these are the basic things. And psychiatry is covered in both in step one and the step two CK. And coming to the step one in detail, it's like what do you say, more of an application based. It's like more of an application based, and most of the questions might be related to what do you say, internal medicine, like internal, the combination of what is internal medicine. It's a combination of physiology, pathology, and pharmacology, obviously. So almost it does cover IM also. Yeah. And also step one is an 8 hours long examination, 8 hours long examination, which consists of 7 blocks. I mean to say, USML, it's an step one is an 8 hours examination. It consists of 7 blocks and 1 hour of break, and each block consists of 40 questions. So total of 280 questions for USMLE step one. And USMLE step one is a 9 hours exam, and it consists of 8 blocks, and each block is 40 questions. So total of 320 questions is a step two CQ. Yeah. To give that exam, they need to pass the second year of their medical school. So they need to pass 6 subjects, that is which are covered in the first 2 years of the medical school.
All right, sir. Thank you so much. Dr.
Thank you.
Afreen, two more questions for you.
Yes.
The first question is, can the IMGs whose parents do not work in UAE
Yeah, I
or
was just
have a
reading that
resident...
question actually. Yeah.
All right, so
Can
yes. So,
IMGs whose parents don't work in the UAE have a residence visa right now have an equal chance of getting into residency without any bias? Yeah, there is no bias actually. Even the non-locals now they have opened this for everyone. It's not just for the locals here. So whether you have your residence visa, whether you're a resident here or not, you stand the same chance. So it's the same for all. So there is no partiality, there is no bias. For locals, non-locals, yes. But for locals, yes, they have a certain seats reserved for them. But the non-locals, I know a lot of, I mean, there are a lot of expat doctors, IMGs who have secured a great spot, in terms of specialization. There is no bias of any sort. Yeah.
all right. And the final question is, as you told, we can write EMRI during the final year. So what are all the requirements for such case in EMRI?
So yeah, for the final year students, since you don't have your graduation completed, on the official website there is a form. You can download it. It's an eligibility form. Okay, it's a eligibility to appear for the EMRI. So you can download this form, fill in the details, your credentials are in, whatever it is, and get it signed by your dean. Okay. So after you have signed it, you can appear for the EMRI exam. So that is the thing. You need not, because that is if you have graduated, you will have to present your graduation certificate, and if you have not completed your graduation yet, if you're still a final year student, you can download this form, fill it, and get it signed by your dean. So that way you can apply for residency, apply for the EMRI exam.
All right. So with that,
The
I would like to
internship
conclude
requirement.
the
Yeah,
Q&A.
sorry. I'm sorry to interrupt you. What is the internship requirement in such case? Internship requirement is the same, like I said, it's 1 year mandatory experience. Yeah.
All right, Dr. Afreen. So with that, I would actually like to conclude the Q&A sessions. And once again, thank you so much for Dr. Afreen and Dr. Gautam for sharing such valuable insights with us
Yeah.
today.
Most welcome.
And
My pleasure.
honestly,
Yeah.
and honestly, your expertise has been so, in all of these has been so incredibly informative. And I
Thank
hope
you.
that, everyone is, in a position where they can all tailor their UAE journey in such a beautiful way.
Yeah.
Um, Just before we conclude, I would also like to inform that all the attendees, if you would like to get their certificates, it will be provided only when you have filled in the feedback forms. So please do not forget to click in the link that is provided in the chat box and fill in the feedback form so that you can receive your certificates.
Okay, thank you so much. I hope this session was insightful and helpful. I think it was, with the number of hearts that were just that I
Definitely.
just saw. I hope it was, and I would like to see this video as well and post it on my socials. Yeah, yeah. Thank you for
Definitely.
having me.
Thank you
Thank
so
you very
much, Dr.
much.
Afreen, for
Thank you.
all the talk today. And I
Yeah,
would
thank you.
request everybody else to stay back for just 2 more minutes, because I have one announcement to make from SSSG side. So as Vinola already mentioned, the feedback form is already provided in the chat box. So make sure that you provide your valuable feedback, and later your name will be eligible to receiving certificates. So when we are concluding today's session, I would also kindly like to remind that this was only day one of our Pathway to UAE webinar. Tomorrow is day two, and we will be having another webinar with the current interns, in fact, alumnus from Tbilisi who are currently in UAE, and they will talk more descriptively about the both DHA and DOH pathways. So please stay tuned. Join us tomorrow as well, 4:30 p.m. in the evening Georgian time, to get more insights on that as well. So yeah, that was it with regards to our
Okay.
UAE pathway. Thank you so much, Dr.
Thank
Afri.
you. Thank you. Thank you, everyone, for joining today. Thank you. Bye
Thank
bye.
you. Bye. I would still like to tell everybody else to stay here. So, good evening. My name is Niyati Vaidya. I am the executive coordinator for SSSG for this term. I have a special announcement to make here since everybody is here, and we thought it to be a good platform to make this announcement. So, as a lot of you might already have, participated in the conference that SSSG held in 2023, the December of 2023, that was Surgicon. An exciting news is coming to your doorstep that another conference, Surgicon again, will be happening this year as well. And this is a special announcement here in this webinar because we are opening the application for the task force for this Global Surgical Summit. This is quite different from what we had last year because a lot of you also had a chance to get in touch with and know Dr. Gregory Nicholas, who is the CEO of IJCR. IJCR is International Journal of Clinical Research. They are a medical journal that publishes high quality, open access, peer reviewed articles, and they have a lot of interactive clinical content for all the physicians, aspiring medical students. And IJCR is collaborating with SSSG this year to have their Global Surgical Summit. This time it's going to be very special and very grand, in terms that this conference will be organized in around 5 countries. So this is going global, and many countries, including Georgia, will be conducting this conference. Other countries that will be having this conference are India, Lebanon, Brazil, Ecuador, and the grand finale, sort of, that is in this run of conferences, is going to be held in Georgia, right here in Tbilisi. So this special announcement was just to tell all of you that we all right now have a very special opportunity to apply to be the part of this conference committee here and be a part of something very huge and very special that is coming up. And I think this honestly is a lifetime opportunity. So stay tuned. We will be soon releasing out the link for all of you to apply to be a part of the conference team very soon on our social media. The different teams that will be there that will work for many aspects of the conference will be logistics team, workshops, event management, PR and marketing, as well as social media. So you can also select a vertical of your choice, whatever you would like to work with regards to this conference. One more thing, as I already said, this is a run of conferences happening. So this is not only limited to Tbilisi, Georgia. We are having these conferences worldwide in 5 different countries. So even if you think you will be somewhere else in any of these countries, I know a lot of us are from India. So if you think you will be in India, during the time of the conference that is going to be held there, then you can also very definitely apply to be a part of the conference organizing team from that country respectively. It is also going to be held in Lebanon, in Brazil, and in Ecuador. So stay tuned on our social media. I think this is a great opportunity all of us can take, and SSSG is bringing this for all of us to be a part of such something as good as and as opportunistic as this conference, which is a global surgical summit this year in Tbilisi. So stay tuned, and again, follow us on our social medias to get more information and be updated with all that SSSG does. And here's to many more events that we are going to have. Also, once more reminding, tomorrow make sure you attend the second part of our webinar for Pathway to UAE. So to get more insights from Dr. Karthik and Dr. Divya, and tomorrow is also going to be a power pack session, and you are all going to know a lot more about the UAE pathway. So yeah, I have sent in the feedback form, just reminding in once again, so that you all can fill it, and we will have your names ready for the certificates. Thank you so much for joining in today. In case you have any more questions, even with regards to this conference that I already talked about, make sure you can DM us on our social media, or even get in touch with anybody from SSSG team. Thank you for joining in today, guys. Hope to see you tomorrow again for the part 2 of the webinar. Have a good day. Bye-bye.